We are not trying to get everybody to move to Austin, but I just want to say it is a great city, and we really welcome you all here. Um, I hope that while you're here, like Dan said, that you'll be able to experience some of those things for which Austin is so well known. Obviously, we're known as the live music capital of the world. We also have some amazing Tex-Mex and barbecue. But we also have the innovation and creativity, which drives this city. It's a city that reflects many of the same qualities that we value in science. So, that bold thinking, the diversity of perspective, and a willingness to explore new ideas. And it's fitting that we have our conference here because we are bringing science, ideas, and spirited discussion together with all of our private and public sector sponsors. It's a true reflection of the unique HEI model, this public private partnership operating at the nexus of science and policy. This year's conference comes at an especially important moment for HEI. We have released our bold 2025 to 2030 strategic plan outlining our vision for the future. This plan builds on the robust history of supporting the highest quality science, as you know. Since our founding, HEI has supported more than 390 research projects, produced over 275 comprehensive reports, and contributed to more than 2,500 articles in peer-reviewed journals. The past year alone, we've supported cutting edge research across multiple continents, helping to answer some of the most pressing questions out there about the health effects of air pollution. I'm just going to highlight a couple of our most recent reports. One is about how vehicle emission regulations and local congestion policies affect birth outcomes. Another is examining the mortality shifts linked to reduced pollution during the COVID-19 lockdowns. And then another report which explores links between air pollution, brain connectivity, and emotional development in adolescents. So these reports, along with many other scientific products, reflect the complexities and far-reaching health implications of exposure to air pollution, as well as HEI's evolving role in helping to ensure that this high-quality, independent science informs policy and improves public health. As we look ahead, our strategic plan for 2025 to 2030 reaffirms our commitment to both looking at air quality changes and the changing transportation landscape, looking and assessing the real world impact of air quality regulations. Um, and obviously, a key part of that are the programs within HEI. So it's not just the transportation core work that we do, it's also our energy program, our state of global health program as well. For the energy program, originally this was launched to assess the potential health effects of energy transitions. This program helps to fill the critical gap in evaluating how changing energy sources and technologies from natural gas and renewables to battery storage, hydrogen, um, impact air quality and health. In the coming years, as governments and industries shift toward cleaner energy systems, um, looking at how this work, our analyses and the work that we fund and support will be essential to understanding the health related impacts of that clean energy transition. And our global program. Our recent State of the Global Air report made clear that the stakes could not be higher. Air pollution remains the second leading risk factor for death worldwide, with more than 8 million deaths in 2021, including 700,000 children under 5. So the stakes could not be higher here. I do want to say, as we gather here in Austin, please take full advantage of this moment, diving into the research, engaging with your colleagues, and help shape the science that will form policies moving forward. And of course, if you have time between sessions, yes, the music is fantastic, the tacos are amazing, and the city's spirit of innovation can help inspire your next idea or something that we might take on as our idea and fund in the future. So please let us know if you have thoughts about HEI's what you think of in terms of priorities and research areas. So thank you all for being here, and welcome to Austin. Thank you.
Well, good afternoon. It's always a pleasure to be back at the HEI's annual meeting, to see all great friends and colleagues here, and to think about and reflect on all the wonderful work we do. We have a terrific session lined up for this afternoon. And I think, hardly a day goes by where we don't hear about generative AI and how it's going to change our lives, how it's going to change the future. And it's no surprise then that it's having a huge impact on our capacity to understand environmental exposures and their ensuing consequential health effects. So when I sort of reflected back, I think I did the first machine learning model for air pollution back in 2008 or something like that. And it was running on something that was called Super Learner, that was coming out of Mark Vanderland's lab at UC Berkeley. And I didn't believe that it was going to work. I really felt like, oh, these are black box. I'm not going to get a good prediction out of this. I won't trust it. So I put independently 2 of my best graduate students and a postdoc to run the very best models that they could get for a land use regression model predicting air pollution across California. And every time the machine won. And it wasn't just that it won in terms of total prediction, it often produced models that were more parsimonious and simpler, but had superior predictive capacity. So I soon learned that you really can't beat the machine when it comes to prediction. Now we're starting to ask other questions about causality and health effects. And there we really have to generate understanding. So there are questions about whether we can do that with artificial intelligence at this point, and we're going to hear a lot about that this afternoon. Now, a lot's happened since those early days, and when we think about artificial intelligence, generative AI, language learning models, foundational models, we have to put it in the context of the tremendous technological advances that have happened already with satellite remote sensing data, cell phone data, all the exposomics data, and the supercomputers that we really couldn't have dreamed of 10 or 15 years ago. So it's really not just the artificial intelligence, but it's this confluence of new technologies and new methods and ways of thinking that are coming together to empower the artificial intelligence. But I think, like any new technology, it's a two-edged sword. There are going to be huge benefits and leaps and advances going forward, but there are also going to be questions raised. There are going to be problems that are generated by this new technology and new way of thinking. And, will the black box, as I alluded to, will it actually cloud our ability to understand causal relationships, because we're not seeing how the models are actually being developed and thinking through it in a tractable way? Will the AI exacerbate existing inequalities in environmental exposures by empowering certain groups who are already advantaged to increase their advantage rather than equalize that among groups? And it's possible it could go the other way too, and we'll hear a little bit about that this afternoon. Who actually owns the data? That is a major question, and for many people in government that are visiting with us today, you know that you're not allowed to use AI, because the minute you do, your data becomes part of the broader cloud and the data infrastructure. So there's a question about data ownership and secrecy that's very important. And finally, when we think about AI models, the possibility of model collapse is real and could start happening fairly soon. And what that means is that as we train these learning models on data that's already been generated by AI, the quality of that data going in to create those algorithms is reduced, and it can lead to poorer outcomes as we go into the future. So trying to deal with that issue of model collapse is going to be a critical thing that we have to think about going into the future. So as I mentioned, we really have a terrific session. We went through it last week, and people on the stage were much more organized than I would have ever been. They had their slides mostly ready by Friday. And I've seen them all, and they're really, really exciting talks. And I think in the words of William Gibson, the futurist who coined the term cyberspace, The future is already here. It's just very uneven. So let's see just how uneven it is. So I'd like to turn it over to my co-chair, Eva Samoli.
Thank you, Mike. So I would like to introduce our first speaker for today, Dr. Claudio Batiloro. He is a postdoctoral research fellow at the Harvard National Studies on Air Pollution and Health Group. Claudio's research interests include AI, theory and methods for signal processing and stochastic optimization. He is currently working on the first of a series of AI foundation models for climate resilience, while also designing innovative power grid optimization strategies to reduce the health impact of the increasing AI-related electricity demand. So, Dr. Batirolo.
Thank you. Okay, can you hear me? I think so. So I'm really happy to be here and thank you for inviting me. This is such a great company. This talk is entitled The Evolution of AI in a Changing Climate. And what I really want to do with you today is exploring how AI has been interacting with health sciences, climate science, and still interacting, and also to understand how these forces can be synergized to work towards AI-informed climate adaptation. So I want to start with this slide that should tell you what is the potential of working at the intersection of AI, health, and climate. And everyone in the room knows better than me that climate change is bringing more extreme weather, we have more wildfires, the disease patterns are shifting, and so on and so forth. So it's becoming more and more complex to understand and mitigate the health impacts of this event. And in this case, AI comes with a promise that is its possibility of analyze a massive amount of data and its ability of extract generalizable patterns from them. This will be the ultimate goal of having better prediction in the task that is worked for, but also, and I will go more in detail, the fact that these insights are generalizable is very important. It is really a paradigm shift from classical stat to foundation model. But I have to tell you something, I'm not an AI enthusiast in reality, so I want to start saying, is all of this really, really true? I am an AI researcher, but I'm not an AI enthusiast, and this will become important during the talk. And the way I will go through this is, first I will give you a brief outline of how AI has been evolving in health, then of how AI has been evolving in climate science. At that point, I will ask the question, why do we even need AI for healthy climate adaptation? And the convergence here is that if we add new AI models that are able to jointly tackle climate and health tasks, we could really have a paradigm shift towards AI-informed climate adaptation. But of course, and Michael did a great job introducing some of the themes that I will go through. AI has a lot of dark sides, and most of them are probably somehow more important to the application of AI itself. So I really care about going through them and give you my perspective of why we should reckon with the future of technology, society, and climate, especially in light of AI. So let's start from AI in health. These are very, very simple slides, but it's just to kind of go through things in a chronological order. AI for health at the beginning was not AI, it was just basic statistical models. And with this, I mean logistic regression, linear regression, they have been used, they are still used, and they perform very well, but because they are simple, they are interpretable, they are linear, although they can mostly work only with tabular data, and they are not generalizable. Here I want to elaborate more on what I mean with generalizable. If you have to fit a linear regression model on a certain study, and then you want to change study, you have to fit another model. So if a model is generalizable, you don't need to do this. I know it's weird, especially from a statistical point of view, but I think this is the shift of AI. Here is just a reference that tells you how linear regression has been super successful in medical research in this case. And then from the early days, we arrived to the middle age when we switched from basic statistical model to less basic statistical model. We started calling this stuff machine learning. And some of the models like gradient boost, random forest are still very used, and they work still very well. Oftentimes, they work better than modern AI models. But again, they are limited by the fact that they are not generalizable, and most of them can work with mostly tabular and temporal data. And here, I just report some other ref that kind of prove the success of these models in medical research. From the Middle Age, we then arrived to modern times, and modern times is the departure from classical statistical machine learning models to deep learning, so to artificial neural network. And the reason why artificial neural network exploded in all the domains, and in the particular case of health, is because they can process massive amount of data that are unstructured, raw, but are information rich. And this in the medical domain translated to the fact that for the first time, we could process a massive amount of electronic health records directly in natural language. And these models are complex, are less interpretable. These are the black box that were mentioned before, but they can capture nonlinear behavior. They work with multimodal raw data. And yet they are not generalizable. So a neural network is any other supervised method. You need to fit it for a study and fit it for a different study. However, their potential of working on EHR gave rise to a huge corpus of literature here. I'm just reporting 4 of them, but I could go on practically forever. And then after the modern times, we arrived to the contemporary times. And the contemporary times is the moment that we departed from deep learning models to foundation model. A foundation model is what gave rise to our current definition of generative AI. Now, a foundation model is simply a very large deep learning model that is trained in such a way its outcomes are generalizable. So here there is the paradigm switch. These models are, again, non-complex, non-interpretable. We are working on that, but we are still very far. They can capture nonlinear behavior. They can ingest a lot of multimodal data. And for the first time, they are generalizable. So the same model can be applied across different tasks. And this was really a revolution. Like the GPT revolution was because of this, because for the first time, you had a textual natural language model that was able to kind of reply to whatever you're asking to it. And these are all different tasks. So the problem with them is these models are huge, are computationally huge, and they are becoming bigger and bigger with some inversion in the trends. But at the moment, we are still going bigger. That's not a good thing. And foundation model for EHR, that was the natural consequence of what I was talking about before. So we had something from Google. This I don't remember, but it's from academia. This is again Google that is providing an entire suite of health AI models and resources. We have the Harvard Medical School that had a foundation model for cancer. Then we have Stanford that had a foundation model for EHR as well. And again, I could go on forever, literally forever. While this was happening in health, in climate science, a similar revolution was happening. And I will not go through details, but the classical approach that you probably know better than me is that we simulate the atmosphere with physics-based model. And in the case of weather, these are the numerical weather prediction methods. And all of these approaches work very well. They are reliable, they are very well refined. They somehow suffer a little model mismatch. And the other downside is that they have scarce data assimilation ability. But anyway, they work very well. This is still the standard, and they are more than okay. However, the Gen AI revolution arrived here in climate science. And, the foundation model were generalizable. So for medical tasks, they could perform different medical tasks all with the same model. What is the translation of generalizability in climate science? We want to simulate atmosphere. We want to simulate all the quantities in the atmosphere with a single model. This is kind of the trend. And these models have been produced. A couple of them I will talk about. They are reliable, they are refined, they mitigate model mismatch, they have a huge data ingestion capability, but again, they are very, very complex computationally. Here, I'll show you the 2 most famous model. This is one from Microsoft. As you see, even the title is very catchy. The first large-scale foundation model of the atmosphere. And then we have another foundation model from Google. Both these models can actually also predict pollution with more or less good results. But this is currently the direction we are going towards. Now, you've seen all these developments in AI for health, all of these developments in AI for climate science, but they are disjoint. These branches kind of go parallel without never meeting. And if I go back to my first slides, then the point here is that I strongly believe that this AI promise for climate adaptation could be implemented only if the two branches converge. So only if you had models that can jointly handle climate, handle data, climate, and handle task. Now, this is where we could go. Very simplistic, but it's just to give you an idea. We would like to leverage the intersection of AI, climate, and health and obtain a paradigm of AI-informed healthy climate adaptation. And this is where we are. Most of you, I believe, work in this area that is, again, very simplistic, but it's statistics, climate, and health. And when we talk about climate adaptation, we talk about this. And then the question is, but why do we need to go to AI? Like, this stuff works extremely well. You know, I take the example of air pollution. The question is always the same. Is exposure to PM2.5 even below the current threshold associated with an increase in mortality? This is always a $1 trillion question. You know, these are some data, but the Clean Air Act benefits are projecting to range between 3 and 5 trillion in 2030. And you know, I now will show some of the works from my lab in particular, but I know that many of you in this room at this table gave seminal contribution that goes in the same direction. And we analyzed the impact of air pollution on health in several different settings, all of them. And this kind of worked out well because, you know, the EPA finalized the strongest standards. The previous administration moved to tighten limits on deadly air pollution. And then the question remains, okay, we are doing things, we are proving stuff, why do we need to go towards AI? And again, I believe that the answer is in generalizability. You know, classic approach works well, but each of them requires a dedicated pipeline. So you need to choose a target population, you need to choose your confounder, you need to choose your exposure, you need to feed the model, and you need also to usually port the data in a format that resembles a tabular format, even if you work on spatial data or longitudinal data. So what a foundation model here could do, and I want to play with imagination here, but I think it's kind of pretty already reality, is that a foundation model for climate adaptation could ingest multimodal data, very misaligned, very heterogeneous. So imagine a model that can ingest satellite imagery, can ingest time series, can ingest spatial data, can ingest all of these at the same time. And we could use it to inform arbitrary adaptation strategies on known variables. So I trained the foundation model on data from the US, and I want to use it for multiple studies across the variables in the US. But here comes the generalizability already in these multiple studies, but we can move a step further. We could imagine to inform arbitrary adaptation strategies on unknown variables. So we train a foundation model in the US, and then we can carry out multiple studies, I don't know, in the European Union with different variables. And, you know, I think this is something that I find very interesting because that means that all or the studies could be reproduced with a single model. That is a foundation model for climate adaptation, a multimodal foundation model that can ingest a huge amount of data and that can produce actionable evidence for policymakers, starting from having better health impact estimation or prediction of climate change in different economic sectors. Now, this is the current state-of-the-art tool that has been released from Google literally 1 week ago, 2 weeks ago, and I'll let you watch the video and then we'll discuss about it.
Introducing geospatial reasoning. You can now bring your data and models together with Google's geospatial tools for easier analysis using Gemini's reasoning ability. Gemini plans and enacts a custom program, searching over data and gathering inferences from multiple models to unlock powerful insights, all through a simple conversational interface. Geospatial reasoning can be a critical tool for advancing public health.
So fun, right? I think that's kind of interesting. But when it comes to public health requests, so you've seen the prompt was, where should we target our preventing public health campaigns? And this answer is given practically based just on social vulnerability and physical activity. So there is really no health inside this model. And this, I think, it's an urgency, that it's a need that we should try to solve. We need climate and health foundation model with explicit health data. Now, likely, in my opinion, one of the problems of Google is that it's hard for them to acquire health data, and that is not necessarily a bad thing, but this is our need in this moment. This is a technical limitation of what we had. And then I want to go even deeper in the rabbit hole, and let's move to the dark side of the moon. Like I told you, I'm not an AI enthusiast in nature. So, you know, AI has a lot of limitation. If you want to use that for medical research, maybe it's better that you supervise it and you check what it's telling you. Or AI is dramatically increasing the energy consumption and the energy demand and the emission in the US in this moment, because the data centers that run the biggest AI models are huge and are becoming even bigger. Of course, if you have more and more emission, you also have an unpaid toll in terms of public health cost. And this is exactly what's happening. I mean, I will not go towards the number, but I really invite you to go check out these references, because the numbers are kind of scary in this moment. And that's not all. Michael mentioned it. We have the problem of model collapse. More and more data are produced through AI, and then they are fed back to the AI, and this actually decreases the reliability of the AI models. Arriving, we in CS for some reason like very catchy words, so arriving to model collapse. And I want to go even worse. There is a privacy problem. Multiple works have been shown that you can reconstruct individual data points, training data points from trained models. So you just access the trained model and you can reconstruct the data points. There is a labor market problem, a lot of exploitation in the labor market due to AI. This is a reportage from the New York Times, and they show that OpenAI is paying less than $2 per hour Kenyan workers to actually label pedopornographic, violent, bestiary content, such that your GPT can answer you better the question that you ask. And I want to go even more general than this. I think this is more subtle, but it's very, very important, and Michael talked about this. The entire market is in the hand of a bunch of oligarchic big companies. And of course, when the situation is like this, community don't really benefit out of it. So in a system like this, you end up having a race problem, a social problem, and I have to say, even a eugenics problem, because you are implicitly selecting the people that can use and the people that will survive the AI revolution. And all of this to tell that the problem becomes accountability. If a model is human-alike, then a model does something wrong. Is it accountable, or are its creators accountable? I think that the answer is easy. Its creators are accountable, but you will be surprised of how hard it is, even legally, to make the creators accountable and not the model. And more on accountability, when you listen to especially big tech guys, they are like, we should regulate AI because the apocalypse is coming, we will have the singularity and so on and so forth in 50 years. But this is just a way of not making you think that AI is already exploiting labor. AI is already producing emission. AI is already having an impact on our world in this moment. So, I think that there is a where we could go or where we are, but there is also where we should go. I am an AI researcher, and I really believe that narrowed AI tools that are under control, are tested, are safe, especially when it comes to climate and health application, are useful. So this is not the paradigm I would aim to, but this is the paradigm I would aim to. I want to validate, regulate the model, make them energy efficient, have a way of quantifying their uncertainty, and especially make them really serve the communities they should serve, they are supposed to serve. So, I want to conclude this talk and set the stage for the other amazing talks that are going to come with a simple image. And I want to also thank Rob Benjamin, that is a researcher that I really admire for inspiring these slides. When we think about climate change and AI, we tend to think about world as outcome as binary outcomes. Either we will go through a climate dystopia in which, okay, eventually our world burned down and the robots help to do it, or we go towards a climate utopia in which we solve the climate change and the robots helped us to do it. In reality, I think that both of these visions are wrong because, again, we are in a moment in which the problems are already real. So I would like to suggest to go towards something that is climate dystopia, in which people are still at the center, communities are still at the center, and I believe that AI can be a tool to serve the communities, especially in the climate and health space, but we need to make sure that we are the subjects that are doing the things. And I mean research in academia and all the practitioners in the space. So yeah, that's it. Thank you.
We're going to reserve questions for the.
It's open.
Okay. Can you hear me? Yeah. Okay. Thank you so much, Claudio. That was really outstanding talk. I enjoyed it. We now have remotely Davida Herzl. She's the co-founder, president, and CEO of Aclima, which is a public benefit corporation that measures air pollution at hyperlocal scales. They've also created an enterprise software that translates billions of scientific measurements into analytics for companies, governments, and communities. And she's won numerous accolades, such as Scientific American's 4 innovators who are making healthcare more fair. She's one of Entrepreneurs Magazine's 100 women of influence, and she's a GRIST 50 fixer. So I'd like to welcome her now. I don't know, do we? Yes. Okay,
Yeah.
great.
Can you hear me?
Yeah, we can hear you.
Perfect. Great. Well, thank you so much, everybody. And I'm so sorry that I can't be there in person, but this is a tremendous honor to be in your presence. I wanted to thank Claudio because I think his talk really set the stage for what I wanted to talk about. And so I think, there is a tremendous gap between AI research and AI in practice. And right now, Aclima is preparing to scale our technology across the state of California. Our technology will reach 64 environmental justice communities this year. We will be measuring all pollutants, all greenhouse gases, toxics, heavy metals, and we're saving the state billions of dollars with a technology-first approach. Our technology enables the state and the communities that we serve to target investments in communities that have been left behind. And because there is so much data, it means that AI will play a critical role. I'll talk more about what this deployment means and some of the details of this deployment, but this is a historic effort in the state of California. The deployment is referred to as the State Mobile Monitoring Initiative. It's really built on a history of success. Since 2018, there's only been 19 communities that have been selected for the AB 617 program. And yet, years later, there are thousands of communities in need. There's been about 1.2 billion invested in capacity under the program. And where we started in West Oakland in 2017, that community, which is really, there was a comprehensive report, that community, which was really powered by our technology and data, proves what's possible when high-tech precision means bottom-up community-driven policy. And so just to give you a sense of some of the impacts, which is what we're looking to scale now across the state, West Oakland is now the only community with a fully operational emissions reductions program under AB 617. And the results that we've generated have been validated by the local regulator, the Bay Area Air Quality Management District. We've reduced pollution, diesel particulate matter pollution by 31%. There are 54% reductions in cancer. And the fact that the community focused on diesel particulate matter is a result of our data and all of the analysis. It's a comprehensive community-driven process. They then used our data to apply for a $322 million federal grant to electrify cargo operations. And that grant unlocked about $500 million of investment dollars for green initiatives at the port. And so in 2025, we are scaling up this model to 64 communities in a public-private partnership that's a massive mark of a program evolution. So I'll talk a little bit about that, but it's really a seminal, significant program at a really critical time, not only for climate action, but for all communities in these situations. And so we have a situation right now where we have incredible community demand. Our CARB contract has given communities across the state new hope that they are seen and that change is imminent. They've all been tracking the success of West Oakland, and there is excitement in these 64 communities that's bottom up and palpable. Community members are being given a voice in the data collection, directly guiding it, contextualizing it. The scale of the pollutants that we're measuring makes this the most comprehensive and inclusive pollution mapping program ever. And all of the capacity building. So this is the result of, and just to give you a little bit of history, we've been working in this space for, over a decade, 15 years. It's been a long time coming, but it's been the result of a tremendous amount of community mobilization, regulatory engagement, and state leadership. And so the capacity building has worked, and we have tremendous community engagement across the board. And what I have to say is that when it comes to AI, having community engagement is absolutely critical. And I'll talk about a little bit about why that's so important. But before I do that, I just wanted to give credit where credit is due. We are not the first to do this, but we're the first to do this at scale. The first, there's a number of these programs in academia. I am not an academic, but I really wanted to recognize Michigan State University and Air Care in the 2000s, the University of Houston with the Mobile Air Quality Lab in 2013, that really started to do this kind of work that really set the stage for the kinds of methods and the acceptance that we're getting in the regulatory community. But it's only because of them that we are able to do this right now. And so, we have a history of bridging worlds with really deep partnerships. We have been recognized across the board, whether it's GovTech or Time 100 or, Fast Company. But a lot of that is really driven by our partnerships. We have a 10-year partnership with Google, which was interesting that it was brought up a little bit today. And then we have a long history with CARB of doing this kind of experimentation, and then new entrants like NVIDIA and others that we're partnering with to really scale this capability. And just to talk about what the capability does, and so this is what ACLIMA does. We measure hyperlocal pollution with mobile mapping technology. The current monitoring infrastructure, I don't need to tell all of you, doesn't really tell us where pollution is coming from or who is being impacted. And so as a result, and the technology that's used really hasn't changed since it's evolved, but it hasn't changed a whole lot since the 1970s. It's really difficult to capture those true pollution gradients in communities with the traditional stationary monitors. There's also no direct measurement of greenhouse gases at the source, and almost no measurement of toxics. And so what we've done, so when I saw this, when I saw the state of the networks, I said there's an opportunity to change things here. And I started at like the worst time in Silicon Valley when this kind of solution just was not looked upon nicely by the investment community. And so I was able to convince Google to partner with me to give us control of the Street View fleet to actually demonstrate this, and we did. So fast forward to now, we can really produce incredible, unprecedented insights for action with granularity down to the block level or the source level. And one of the things we proved in the work with Google, we published a paper on this, and there's been a lot of follow-on papers since, that pollution is actually hyperlocal, that it varies by 5 to 8x from one block to the next. And that has gotten a lot of peer review and a lot of attention. The mapping fleet that we deploy is the only fleet of its kind on the planet. We're now converting it all to EV. So in California, we're going to have, I think, 80% EV. And what's really wonderful about the fleet is that it gives us an opportunity to create jobs in the communities that we serve. Again, this is about really drawing those connections between our work and the communities that are impacted. And one of the things that is really a massive gap is the access to economic opportunity. A lot of these communities were left out of the transformation that Silicon Valley enabled. And so our jobs, the jobs that we create, really create an opportunity for folks to kind of, bring themselves up. We have a really sophisticated mapping approach that combines broad area mapping with targeted inspection. The broad area mapping is what we've published on a lot. The targeted inspection is an additional layer of information that we then collect to really understand at a very granular level what those pollution hotspots are. We've been investing in technological innovation for 10 plus years with cutting edge hardware, a portfolio of patents, trade secrets, et cetera. But I think what's more important is the amount of investment that we've made in scientific credibility. And this is where a lot of our peers have really struggled to invest because it's very expensive to do this kind of work, as you all know, where we, published and went through the process of getting our data quality operations vetted and confirmed. And we did that through partnerships with EPA, with CARB. Again, a tremendous amount of work. We've also done a lot of work to invest in relationships. So we're investing in relationships in communities that have been left behind, that where trust is a major problem. And so we've invested a lot in these relationships. And the technology is really an all-in-one solution where, our customer basically says, okay, I want data for this location. They press a button, they get the data. I'll talk about some of the things that we're doing to improve governance of this kind of technology, especially in the government context, but I'll talk about that in a second. And I think, where AI, because we're generating so much information, AI plays a huge role in being able to actually process and make sense of the information, whether it's toxic hotspots, methane leaks in the Bay Area, black carbon impacts, or cumulative burden analysis in places like Hunts Point. We do this in a lot of other analyses across the board, but it's really powerful to enable our customers to press a button and get this kind of data and these kinds of insights very, very quickly. And I think that this is what's really, has huge potential, but also has huge potential for disruption in ways that are not always sort of considered. And I think, when we look at the way that we've done this, so we've done this in New York, for example, where we combined, our technology, because we can do this very hyper-local monitoring, we refer to it as an MRI scan, right? Where you can actually go in and see what those differences are at this very hyper-local resolution. And then we go in with the high indicator CT scan, right? And we can actually look at specific toxics and specific issues that we can then investigate. The system monitors a broad set of pollutant targets that enable us to be very refined in our analysis, in the analysis that we provide the regulators and the communities. And I think, just to talk a little bit about some of the governance issues with regards to IP, with regards to visibility, so that things are not, obfuscated by I think traditional approaches to how these things are shared. I think it's really important to have, and we're doing this. So in our contract, we have open documentation where we are not closed about the underlying numbers on the model. It's open. So that enables the regulatory customer, the government customer, to look under the hood. And if they want to backtrace and really understand how we got to something, they can do that. There's also, a need to really soften the disruption from all of this, because I think we're going from one approach to measurement to another. And they're both completely different. And one opens up a tremendous amount of opportunity, but it's also potentially disruptive. And so making sure that we are handling that disruption responsibly with our government partners is really important, especially in this moment where, the previous speaker was talking about, there is a lot happening right now with the data centers and all of the emissions that are coming from those data centers. And so making sure that we are being extremely responsible is very important. And so I think the other thing that's really important that doesn't get talked about a whole lot in these conferences is the corporate responsibilities. So, there has been talk about sort of different kinds of disclosures, et cetera. But I think it's really important that we cannot just put this responsibility for these kinds of technologies in the hands of, traditional for-profit companies. And so by being a public benefit corporation, we actually have a split fiduciary. So a lot of people don't know that corporations and boards of corporations have a fiduciary to their shareholders, and their fiduciary is to create profit. And so by having that fiduciary, they're actually sort of split. They're not able to actually legally look out for the public benefit. By being a public benefit corporation, my entire board has a fiduciary to public benefit. So I can't just, make a decision that is going to maximize the company's profit. I have to make decisions that maximize public benefit. And that legal differentiator is actually a very big deal, especially in this context space that we're working in the public space. So with that, really would love to hear, as the conversation evolves, your ideas for how we can sort of take this and move it forward in a very responsible way. We're moving into a really, on the one hand, incredibly exciting phase of development in all of this, but also one that requires an open conversation between the innovators, the practitioners, the leading thinkers, the academics, to ensure that we're moving into this next phase responsibly, because there is a lot here that I think we all need to consider and we need to be talking about openly, and it needs to be cross-sector. One thing that I did want to note, I am not an academic. I'm a lawyer by training. And actually, my legal background is what has enabled me to navigate the space in a way that is, I think, unique and really hopefully can add a lot of value. But I also know that I'm not alone, that there's an entire ecosystem here of thinkers and innovators that have been thinking about this for a long time. And I want to make sure that we are really being inclusive of those perspectives to move this forward in a responsible way. So with that, thank you very much.
Thank you. Wonderful work you're doing. And we'll look forward to discussing that at the end of the session when we have the panel. I'd like to now introduce my good friend and colleague, Dr. Perry Heistad, who's a professor at the College of Health at Oregon State University, where he leads the Spatial Health Lab. He focuses on environmental exposures and epidemiology with applications to air pollution, built environment, and climate change. He's developed several really novel methods that he's going to share with us today, using AI for large population-based health studies and geospatial data science approaches. And he's published, I think, 160 articles and has received some $25 million in research funding. So I'll turn it over to you.
Great. Thanks, Mike. And I think I'm filling in for Scott Weikenthal from McGill. For some reason, people confuse me and him all the time. He's my doppelganger from Canada. So if this presentation goes horribly bad, I'm Scott for the next couple of days. But it's too bad he couldn't be here. So why do we need better exposure measures? When we look at chronic disease, we see 10 to 30% is due purely to genetics, with 70 to 90% due to the environment, and this is the environment broadly defined, and gene-environment interactions. So we clearly need better tools to measure environmental exposures, which has led to this exposome concept. So the totality of environmental exposures over the life course. This is not an exposome talk, but I will come full circle when I talk about large language models and how this might actually be the tool that we need to realize the exposome concept in terms of actually making that tractable. So in 2017, myself and Andrew Larkin wrote this commentary. I believe Sarah might have been one of the editors on this, where we were arguing that long-term personal exposure assessment for air pollution was now possible given the confluence of data from smartphones, the sort of novel big data sets that were available at population scale, and personal sensors. To some degree, we've seen this actually realized over the last 7 to 8 years. Using smartphone data, we can now get long-term time activity data. So if you share your location on your phone, if you have an Android phone or Google Apps, you have what's called Google Location History data. So this is just an example. If you go into your Google Takeout, you can download a GeoJSON file that has all of your time location information with modes of transit classified. So are you walking, are you driving, as well as places you visited. So for me, this is everywhere I've been every day since 2015. Very, very invasive data. So we wanted to test, using a citizen science framework, would people from the Washington State Twin Registry provide this information to link to the cohort, to link to their electronic health records. And so this was a pilot. We ended up having 400 twins provide this information. For each individual, averaged 58 months of time activity data. It was around 370 million time location points. So now when we're linking to these fine scale spatial models of air pollution, instead of linking just to residential address, we're linking to where people actually spend their time and when they're there. When we look at the type of environmental data that's available, so this is a map showing the location of air pollution monitors around the world. This is sort of seen as the traditional gold standard measurement method for air pollution. But we are now supplementing this with a lot of novel and different data, right? Geospatial information, LiDAR, satellite-based measures of air pollution, street view measures, high-resolution imagery, the Internet of Things, so all of these devices that are connected that are providing information, social media, and other citizen science data streams. So we have a lot of non-traditional data that we can use and integrate into our exposure assessment frameworks. The same has happened with personal sensors. So there are a lot of new sensors that are available. Most of these are still focused on measuring physiological markers or physical activity or location. But we have seen more environmental monitors emerge. And so these are smaller, these are cheaper, and to some degree, they work better. This is still an area that is developing quite a bit. One thing that we did not realize when we wrote this commentary is how quickly you will be drowning in data if you use these type of data sets. You spend so much time cleaning, linking, and analyzing these data that you just end up with more data than you can analyze. When we look to the future, this is only going to get worse, right? And hopefully this sort of creation of data is not going to be done through generative AI, and I'm sure we'll have some conversation about that. But this is only going to get worse. So when we go back and revisit this framework of what is really going to enable us to do personal long-term exposure assessments, it's the AI tools that are making these new data sets possible, but it's also how we can use them for linking, cleaning, and doing different types of analyses. We've heard some definitions of what is AI and the different components of AI. We have a lot of different tools in our AI toolkit that we can use for exposure science. And I'm going to go through some of these quickly, focusing mostly on what I see as having the most possibility for impact in this field. I think it's important to really show how new or relatively new these tools are for the field. And so when you look at machine learning, artificial intelligence, deep learning, 2010 is really when this explosion of use happened, right? And so 10 to 15 years is not very long when we think of a scientific discipline. But when you look at large language models there at the bottom, that is just starting to happen, right? We are at the cusp of this explosion of applications of large language models. So I really want to stress that how I view AI, this is not merely better prediction. So we're not using machine learning to come up with better predictions of air pollution. or how are we handling chemical mixtures. But it's really redefining what we have available for environmental exposure data and how we can design studies to answer questions that we might not have been able to do previously. And so here I'll put a plug into our HEI report that was recently published. To me, this was an example of trying to integrate as much data as we could. So for 8.5 million birth addresses in Texas over a 20-year period, a range of environmental data that I would say are fairly traditional to fairly novel, to give us the flexibility to design different types of studies to address different accountability questions. So creating this really large novel data set gave us flexibility to have better study design to answer some of our causal inference questions. And so these are just a couple examples of data sets. So we integrated housing characteristics into the vital statistics data that we had. So this comes from CoreLogic. CoreLogic is the data that's in Zillow, for example. So using fuzzy matching and geospatial methods linking at an address level, which then provides household characteristics that are important to environmental exposures. So does that home have air conditioning? What type of home is it? Is there a gas furnace or a gas stove in the home? There's important socioeconomic indicators. So is the house owned? Is it rented? How expensive is the home? And then it gives some indications of residential mobility. So was that home sold during the pregnancy period? These are all variables we haven't been able to include routinely in these type of studies because of the challenge and the size of linking this type of data. This is another example of a novel data set that we did not have even 5 years ago. So when we think about exposure to traffic air pollution, we think about proximity to roads, we think of the traffic volume on that road and the fleet composition, but usually we don't measure congestion. And so we were able to leverage connected device and vehicle data. So this is anonymized travel pattern data that we can use to look at travel patterns and transportation usage estimates that are anonymized. So this ended up being for every road segment in Texas, we had an estimate of traffic volume, but then we also had an estimate of traffic delay or congestion. So trying to look at that specifically. This is an example where we really wanted to try to separate this confounding factor of people who live near roads are probably very different than people who live farther away from roads on unmeasured factors, right? With traffic air pollution, this is something we're really concerned about. But when you choose a home, rarely do you choose that home based on predominant wind direction. So can we use wind as an instrument variable to look at the association between traffic air pollution and adverse birth outcomes? And so here we calculated hourly wind for all of the addresses we had for all of the major roads, which really was only possible by leveraging GPUs for compute. This would have taken way too long using traditional methods in terms of just the amount of calculations that had to be done. So I'm not giving you any health results in this talk. If you want to see those, you're going to have to go look at the report. But we found some really interesting things using these methods. So machine learning, all of those examples I showed relied on machine learning to some degree. They could be simple to complex, supervised, unsupervised methods. I'm not going to spend too much time on machine learning, as I think we're more familiar with those methods. One thing that is new, and I think that has a lot of potential for exposure science, is leveraging images. And so we now have street view images, as well as high resolution satellite or aerial images. And we can leverage computer vision deep learning models to extract information from those at scale. So when we look at an image, intuitively, we know as an exposure scientist what might be important for air pollution emissions on a street. What kind of vehicles are there? Is it a street canyon? And now we can extract that type of information using deep learning models. So for satellite or aerial imagery, that could be just identifying objects in a high resolution image. So I want to identify the number of trees, the number of trucks, the number of cars. There are now fairly established segmentation and object detection algorithms that we can use to just pull out and extract specific features. We can also train models based off environmental data. So this is an example that Scott did where he had global PM 2.5 monitoring data, which is shown in this map. And then he assigned those concentrations to the high resolution satellite image around those monitors and created a model entirely from the images to predict PM2.5 concentrations. And so the areas highlighted on those images are what was contributing most to prediction. And you see that this did fairly well compared to some other modeling approaches. So we can also do this with street view imagery. So this is an example of a street view image with image segmentation where every pixel identifies what it is. Is it a car? Is it a street? Is it a bush? Is it grass? Is it a house? Classifying what is in that image. And because these are available everywhere, right, in the US and in most countries, we can sample images around where someone lives, for example. And so this is an example of the Washington Twin study where we're looking at green space and mental health related outcomes. So similar to predicting PM2.5 air pollution, we can use computer vision models to try to predict more complicated constructs. And so we have another study with Peter James in the Nurses Health Study looking at built environment characteristics in urban green space and cardiovascular disease. And so we can use street view images and segmentation to say how much trees are on a street around where you live, how much grass. But what we wanted to try to do is could we predict quality related measures? So what is the quality of green space on that street? How safe is that street for pedestrians? How attractive is that street? And so here, the first thing you need is you need the training data to develop those models. So we used Mechanical Turk, where we paid people like 10 cents to look at 2 images, and they'd say, what image has the highest quality in nature? Which street is safer for pedestrians? And that created the training data to develop a deep learning model. And so for nature quality, this predicted around 70% of our measured perceptions of street view nature quality. And then we can apply those to all of the street view images in the US to link to different health studies, which I show here in this map. Okay, so now moving on to large language models. So these are a type of deep learning model that's trained on vast amounts of text data. How many people use ChatGPT, Gemini routinely in their work? Okay, so that is not as much as I would have expected. If I ask my students this, it's 100%. So these are really adding value now in terms of what we are able to do in terms of integrating data. This is also moving extremely fast. So a year ago, I uploaded a street view image into ChatGPT, and I said, rank this, 0 being the lowest quality nature, 100 being the highest, and it responded, I don't have the information to do this. That was 1 year ago. Now, if you put an image in, this is what it gives you. I rank the nature quality of the street as 25 out of 100, and it tells you why. Why did it come up with that ranking? And so this is a model without any prompts, any fine tuning. This is the off-the-shelf ChatGPT model. And so right now we're evaluating, well, how well does this actually work compared to the perceptions we measured? And it seems to be working fairly well, right? So we spent 3 years collecting this information, developing a new deep learning model, and it seems like an off-the-shelf LLM is doing not as good, but fairly good. We don't know if it ingested our information, right? So like all of our training data is on GitHub. But this was an eye-opener to me in terms of where the future of prediction might be going. And so coming back to the concept of the exposome, right? There's been a lot of talk and effort and workshops defining the exposome. How do we implement the exposome? And I think large language models might actually be the tool that we need to get some traction in the exposome concept. We heard about foundational models. There's a number of different foundational models in more methods related, like computer vision, segmentation, natural language processing, as well as applications that we heard about in terms of climate and health. But what I think we actually need is one of these foundational models for environmental exposure science, or the exposome. So taking an open source LLM, so right now the best open source LLM is Meta's Llama models, and fine-tuning that model with all of the environmental exposure related data that we can provide it. And so this is structured monitoring data, this is unstructured monitoring data, this is geospatial information, this is health impact assessment reports, this is risk assessments. ChatGPT estimated that it would be around 200 billion tokens to retrain or fine-tune one of these models to fully capture environmental information. That is a massive undertaking, right? If you think about ingesting that amount of data to fine-tune one of these models, this is something that we as a scientific community would have to get behind. This is not something that one group can do. So we're trying to do this just for one exposure, noise, in one city, Portland, to see how well it works and how much information we would need to actually train one of these models. But if it does work, right, we integrate all of our environmental exposure related information. It doesn't matter what format it's in, right? We can integrate that. If it's images, if it's text, if it's audio, we integrate that information. It could enable this total environmental exposure concept. There could be a lot of applications to personal exposure assistance. So think of a chatbot that could refine outdoor exposures for what you experience in your home, based off your job, based off your commute patterns. It could really personalize a lot of the environmental exposure information we have. It could be updated with new information as it comes in and fine-tuned to different contexts. So this is sort of the big vision of where I think things might be going. But there are a lot of ethical and responsible use considerations that we've already heard about. The direct environmental impact of large language models is huge. If you think about energy use and water use, this is something, especially as a field of environmental health, we cannot ignore. This is a major, major issue. The issue of copyright, in that these models basically scraped the internet and took all the data and information they could find, right? And this is currently in the courts. I mean, these large companies are being sued by multiple people in terms of them taking their data and ingesting it into their models. Privacy and confidentiality, even for exposure assessment. So for ingesting health-related information, that's totally different. Even for exposure information, this is something that we have to be really, really careful about. The bias and representativeness of environmental data, how we can interpret these models, misinformation or hallucinations that these models are still prone for. How do we give credit or attribute ideas, right? So if you think about this, the scientific method and process where we build off of past research and give credit to those researchers, how do we do that with large language models? Right? It takes everything and integrates it together. And then the potential risk of just being too reliant and dependent on this type of automation. So I'll close with my main conclusion is that we really need better collaboration with computer scientists. So environmental exposure scientists need to be at the table when we're talking about how do we train these models? What type of data should we use for fine-tuning an environmental exposure model? How do we make sure that's representativeness of all population groups and communities? This talk was also focused on technologies that are available now. So this wasn't looking into the future. This image is from the NVIDIA conference this year, showing the potential trajectory of where we get to agentic AI, physical AI, and then potentially AGI. And so that would completely revolutionize, for good or for bad, a lot of scientific disciplines, including ours. And so with that, thank you, and I look forward to a discussion.
Thank you, Perry. I will introduce now our last speaker for this panel. Dr. Marianthi Anna Kimijoglu is an environmental engineer and epidemiologist. She received her master in public health from the University of North Carolina and her doctorate in science from the Harvard School of Public Health. Her research focuses on evaluating the impact of exposure to climate change-related exposures such as temperature, air pollution, cyclones, and wildfires, and on methodological issues in climate and health applications, including assessing high-dimensional exposures in health models and characterizing exposure measurement error. She's currently an associate professor at the Environmental Health Science Department at the Columbia Mailman School.
Thank you, Evie. There will be a lot of repetition in what I say compared to others say. Think of this as a, collaborative reinforcement learning experience on artificial intelligence themes. And also, mine doesn't have as many nice or any actually figures, so I'm sorry about that. So I'll start with causal inference because I'm going to be talking about the use of AI in causal inference for environmental health studies. So first of all, I'll say that to date, I have not yet met any epidemiologists who actually wants to find an association. We all care deeply, I think, about the actual causal effects. That's why we're in this field, and that's why we're studying this. That said, I do fully recognize that there are many biases that could result in biased effect estimates, which can then impact causality interpretations. So for this reason, we are now seeing increasingly the development of use of causal inference methods. Now, these methods, they're not perfect. They still have limitations. But what they allow us to do is they allow us to evaluate explicitly counterfactual scenarios, which traditional methods don't really help us do. And they help us provide robustness against model misspecification, which is great. That reduces the possibility of bias. It does not take it away, of course, because these methods can yield effect estimates that can be interpreted causally under appropriate assumptions. And this is the same statement for non-causal inference methods as well. It's just that the assumptions here are somewhat smaller. And then we have machine learning. So machine learning is a field, as Perry just showed you the graph, that has been exploding since about the 80s. The goal of machine learning is to maximize predictive accuracy. That's what machine learning was developed to do, and it keeps being developed to do. Also, machine learning is great and accommodating high-dimensional and complex structure. Our data are becoming increasingly high-dimensional and complex. Perry again talked about the exposome. But clearly, prediction is not causal inference. That said, though, there have been, for years now, this is not necessarily that recent developments that allow leveraging machine learning algorithm in causal inference models to increase flexibility in modeling complex relationships, nonlinearities, non-additivities, et cetera, while preserving valid inference. And an example here, one example, there are many, is targeted maximum likelihood estimator, TMLE, that is being increasingly used. It was introduced by, Mark Vanderlaan, whose lab Mike used for his first superlearner prediction model in 2006. And TMLE integrates machine learning and statistical inference to reduce bias in efficient and robust estimation. So we are seeing evolution there. You've seen this already. Machine learning is a subset of artificial intelligence. Actually, artificial intelligence was first conceptually introduced in the early 50s when Turing asked, will machines be able to help? The term artificial intelligence was coined later in the 50s by a computer scientist at Stanford, John McCarthy. In the 80s, as I said, machine learning now starts being developed and exploding. In 2010, deep learning revolutionizes really everything and what we can do. And just a couple of years back, we now are at generative AI models that rely on deep learning. The most common ones are large language models. These are to generate text. That's the generative AI, right? They generate. But also there are Gen AI models and algorithms for sound, for music, for video, etc. So AI and causal inference, it's still very, very early for this to date. There is definitely growing interest in deep learning for causal inference, including methods that can infer causal structure, for example, using variational autoencoders, and learn balance. Learn representations of the data that can balance confounders across the exposure gradient. So this is fantastic. They can also help us simulate interventions. Both of these are amazing features for causal inference. As I said, this is very much still in nascent stages, and I have not yet seen any application in any environmental health studies, not specifically even in air pollution. One example approach is GANITE. GANITE stands for Generative Adversarial Networks for Inference of Treatment Effects, and it uses generative adversarial networks to estimate potential outcomes and individual treatment effects. These GANs, the way they work is they develop two neural networks. One is a generator, the other is the discriminator. The generator just generates data. The discriminator is trying to then disentangle which data are the generated ones versus the actual observed data. And then with this training process, the model learns the generative mechanism for the data. And so you can see how this can be very useful when we're interested in causal inference. There are important considerations, and again, these are specific for causal inference. These methods are extremely, extremely data hungry. All Claudio, Davida, Harry, Perry, I don't know why, who's Harry? They all talked about billions of data points. But for causal inference, our data, or in our traditional epi-studies rather, our data are not that big. And especially if we're interested in the internal exposome and we have biomarker data, then our sample sizes are actually quite modest. So will we be able to use these data until we have information, even in biomarker data for everybody? That remains to be seen. Algorithmic fairness is a very, very big concern, because this is similar to machine learning algorithms, that historical and structural biases can be perpetuated depending on the data that are fed in the models. Interpretable and explainable AI. Deep learning is a very, very black box. And I would think that the definition of causal inference is that we want to understand the cause, understand exactly what the relationship is. So and it's important to not only understand the solution and be able to interpret it, but also understand how the model got that solution. And there are options for post hoc tools that can show feature contributions to each point, etc. But this increased explainability and interpretability, but we're not there yet. And finally, reproducible AI. These results from these models can be sensitive, again, depends on sample size and algorithmic fairness, etc. But these results can be sensitive to code details, random seeds, hyperparameter settings, etc., etc. The problem with this is that when I use these methods and I write a paper, in my methods section, I cannot include this information. No one will read it. So how will anyone else be just able to reproduce exactly what I did, which is very important in research. So that was AI and causal inference in general. As I said, AI and causal inference in environmental health studies, not really anything there yet. So I turned to our good friend ChatGPT, and I asked if it can give me 5 bullet points about the use of AI and causal inference, if possible with environmental health applications. And so we had a good chat. I had to refine the question. So for example, in the first iteration, it said, well, you can use Lasso, for example, to identify confounders. And I was like, dear chat, my dude, first of all, no, Lasso machine learning, I specifically asked for artificial intelligence, but that aside, also causal inference. We're not using a variable selection, even a fancy one, method. It also suggested BART for identification of heterogeneous effects. So after a bit, back and forth about what I needed, it eventually gave me this list. which is actually a pretty good list. It's not about anything that has been already applied. This list is about how we could potentially use AI for causal inference in environmental health. That includes causal representation learning, methods that uncover latent structures that can help adjust for unmeasured confounding. I don't think that's true. Unmeasured confounding, if there's no information in there, will still remain unmeasured confounding. Although I would like to discuss this in the chat afterwards with everyone. Bias correction via generative models to simulate counterfactual scenarios. Emulation of hypothetical interventions, actually, that's a very good use of potential AI that I think will be fantastic and faster. Quantifying and propagating exposure uncertainty, that's not AI specific. It says Bayesian deep learning here, but we are already doing with machine learning. Not very widely used, but that's something we're already doing. And finally, causal discovery in complex systems. So some methods, no tiers is not deep learning, so I don't know why it gave it as a AI tool, but some algorithms claim that they can recover the causal structure in our data, which could be fantastic if it holds. So there is a lot of promise on AI use in causal inference for environmental health models. We are definitely not there yet. It'd be interesting also talking about uncertain propagation. We're definitely farther out for prediction of these exposures, of ambient exposures, which is fantastic. Understanding the uncertainty of those predictions for our health models will be also important. So far, mostly traditional machine learning approaches are being increasingly used, both in terms of causal inference, but in general environmental health as well. For example, many machine learning approaches are being adapted and implemented for mixture studies. Better adoption so far in the exposure assessment side, definitely. We talked about some potential consideration. So in the meantime, what I want to speak in the next few minutes is how are we now using AI for causal inference in air pollution health studies? And this is basically what we do, is we asked, it's not very exciting, but we asked ChatGPT to help us edit our text for our manuscripts and our proposals. Sometimes we bounce ideas, like I just asked it, how can I use AI causal inference in air pollution health studies? Someone may ask, hey, Chat, what's PAHs? Can you please let me know? Generate graphs for presentations, which I clearly did not do for this presentation. And I want to talk more about 4 and 5, help with code and help with lit reviews. Before generative AI, we had to spend hours Googling how to code certain tasks, hours, and understand, no, this is my case, no, this is not. This Stack Overflow said this guy, but this other person, it was days. So ChatGPT or other Gen AI tools have really, really helped us a ton with this. They can provide quick coding advances and examples. It saves times. And I think also what's very nice is that they can encourage good coding practices. Every time I've asked ChatGPT for code, it will give me a function. That means that I will learn how to write functions. That's amazing. But that said, when it comes to implementing advanced statistical methods, Gen AI can produce beautiful, the code is beautiful, but it can be very wrong and can be very confident about it. And I hadn't realized that until I was in a meeting with one of my students and they wanted to do something. It was about a multiple imputation thing. And ChatGPT gave great code. I looked at the code and I was like, that's actually not at all what we want to do. This is very biased that it gives you. So I'm wondering, had I not been in the meeting with my student to understand that what ChatGPT did was wrong, and indeed the results were quite different actually, and we had reached different conclusions, would the student alone be able to detect that? So, and when we read the methods papers, the methods sections in papers, they will read nice. Hopefully everybody makes their code together, publishes their code together with the papers, but that's, although an increasing practice, it's not universal yet. And the last one is help with literature reviews. Gen AI can identify relevant papers very quickly, summarize findings very efficiently. So it saves us a lot of time. Sometimes it makes up papers. That's hallucination. I see that with my students in the class that I teach every time, even though I ask them to check that the citations are indeed true. Sometimes it lacks access to full text. Now, Perry talked about IP, and that's very important. But also in this case, that means that it might not have access, sometimes it does, to very important papers that would need to be included and potentially say different things than the papers otherwise accessed. It cannot, importantly, critically assess study quality or causal claims. So it will tell us basically what the authors concluded. Do we agree with what the authors concluded? Or not? Do we think these are biased conclusions? And so for that reason, it can produce biased or overly confident summaries. So in summary, I think AI is a very, very promising tool for causal inference in environmental health studies, especially when we're talking about complex high-dimensional data, big data. That's very important. We need huge amounts of data. Still very in early stages with important limitations, fair, explainable, interpretable, reproducible AI, as we talked. Causal assumptions will never go away if the data I feed it are very sample, it's a very biased sample, or if I miss key confounders, it cannot make, well, it can make up data, but not necessarily the data to reduce our bias. Generalizability and transportability are also concerns for causal inference. But even as we currently use it, so not Ganite, for example, but help me with code for this diff analysis, it can be very helpful with caveats. So I think my big conclusion here is that AI can greatly complement our research, absolutely hands down, but it cannot and should not replace a robust training in epi-stats methods. And with that, thank you.
Thank you, Mary Anthony. And let's give our speakers a big round of applause. So we've got about 12 minutes for questions, and I'd like to invite people to come up to the microphones in the center aisle if you have a question for our speakers or for us or the audience more generally, or a comment.
Hi, I'm Melissa Perry at George Mason University and chair of our review committee for the HEI. Thank you for a fantastic panel. Really enjoyed it, learned a ton. I have a question, I think, for Claudio and for Mary Anthony, as you were discussing the black box and the inability to reproduce findings. And Claudio, at the very end, I really appreciated the schematic of what is possible and where we should be going. And you built out the validation, the transparency, the inclusion of community voices. I thought that was really powerful. I've also heard the monopolistic technocrats touting open source. And so I was hoping if the two of you could help us understand the notion of open source, because it seems as though designers and programmers are saying, don't worry, it's all safe, it's entirely in the open domain. But if I understand correctly, that's a bit of an oxymoron. I was hoping you could unpack that for us.
Yes, sir.
Yeah. Thank you for the question. I think it's a very interesting point. We could talk forever about this. I believe that there are different layers, even in the open source philosophy, especially when it comes to AI, because for example, the Llama model that we discussed is an open source one, so you can get the model itself. But if you get pre-trained version on it, you don't know exactly what are all the data sources. And on the other, this is one example of open source. This is standardized. Like we have open source and this moves at different layers, so we know this. On the monopolistic side, I believe that it's not necessarily just about making things open source. But I personally believe that it would be nice if, for example, I say academia, but could be whatever other subject, could catch up with the computational power needed for designing certain models, with the amount of data needed for training certain models. And I think that your question is very on point exactly in these days, because a paper that I really liked came out a couple of days ago, or 3-4 days ago. And the paper that I advise everyone to give it a quick look is called The Illusion of Leaderboards. And you know, the entire AI market moves around the fact that this language model works better than another on this core, this language model works better than the other on this specific task. And we have a lot of allegedly open source companies or closed source companies that are designing benchmarks for AI. But in reality, this paper kind of, the conclusion is one sentence, that this is all fake to some extent. Like there is some data distillation in the models, some very famous benchmark. There is the AGI benchmark that actually developed by some academics and company are had an agreement with OpenAI to kind of give them part of the test set and a push for the performance. So, you know, I believe as long as not everyone is put in the same condition to do research, this is a problem that will remain. And I want to conclude this argument saying that I feel that we should first of all ask ourselves, like we have seen the image from the NVIDIA CEO that we are going to generative AI, agentic AI, physical AI, and at the end of the day, AGI. And we have been always told that this is going to happen, like AGI is going to happen. I'm not sure that we should not question this, like why are we going towards AGI and what could be useful for it? I really believe that having smaller systems that are tested, that are principled from an engineering point of view. So you know what is a stress case, you know what is a test case, will be better. But that's just my opinion, I guess.
Okay, thanks. Did anyone else want to comment, or should we go on to another question?
Go on, so more people can ask. Yes.
Yes, so maybe we'll go to the back of the room and then.
Thank you for just a wonderful set of presentations. Kathy Enser from Rice University. So if we step forward a few years and everything is sort of percolated and this is the world that we live in, if you're a community member or an official at a smaller city, how would you ground truth the information that you're receiving? Is there any sense of what that might mean?
That is a really great question. Yeah, you hear different, I mean, it sort of came up in these talks of how these kind of large language models will really provide new tools and opportunities to people who might not have had them before, be it small community groups or marginalized populations. I think that's yet to be determined in terms of what that will actually look like. But for validating the models, this is where I think, at least from the exposure science community, we're still going to need high quality measurement, data collection, until we're confident that these models are doing what we think they're doing.
So does there need to be some guidelines around what that might need to be?
And I was just going to say the exact same thing, that I think our project in California, for example, has the potential to sort of establish a template for how we do that. How do we, you know, especially in communities where you've had very different lived experience from the measurements, that's just been a longstanding delta. And so I think it's going to be critical that they trust and that they know that the measurements that are being taken reflect their lived experience. And that's the only way that we're going to get to a sense of truthfulness in the models and all of this, and that's why it's so important that they're open and we're following a very specific protocol on openness that comes from the Allen Institute. And so I think it's going to be in that convergence. But yes, these are exactly the questions that we're asking.
Thank you.
Great. I guess we'll make this our last question.
Hi, Chad Bailey from EPA Office of Transportation and Air Quality. When I deal with AI, I usually have it ask questions to help me clarify my question. So I might be doing that with you. And I think my question's aimed at Perry Heistad. There are certain state laws that limit the amount of disclosures homeowners have to make about the condition of their house. For example, radon or water damage or lead lines. I'm wondering how these kind of large scale exposure models deal with those kind of issues, both in terms of the fact that they're not public information and also the fact that they are somewhat protected information. And there's kind of, on one hand, there's kind of you might be able to find a way around it, but should you is the question. And I'm kind of wondering about what do you do with that?
Yeah, great question. So with the CoreLogic data that we had, that type of information was not included. It was really the household characteristics and sale related information. But I do know a lot of groups that would be interested in those type of well water tests for home disclosure or radon. I think that does vary state by state and jurisdiction by jurisdiction in terms of if that is made available. But even when you're using the sort of standard CoreLogic information, you have to be very careful in terms of what information you include and exclude from that data. So when we were using that, we had to exclude any personal identifiable information before we did any linkage. So we could only include sort of physical characteristics of the home. I was amazed to see there were credit scores in that data set for people who bought that home. And that was publicly available information. So I think the privacy issues related to some of these big new data sets are very real, and we have to be very careful in terms of how we use those type of data.
Can I add something?
Yeah.
I want also to take my personal experience about this, because for the models that we are developing, we are using the Medicare claims data. And so, of course, there are a series of privacy barriers, and I truly believe that there should be no way to reconstruct data from the structure of the models or the embeddings or whatever we release. But I want also to point out that this is related a lot to is state dependent, is country dependent, depends on the kind of regulation. For example, this sounds ridiculous because we all have this common stereotype that in the US, privacy, I don't know, I'm from Europe, but in the US, data privacy is somehow less regulated than in Europe, and this is totally true. So, for example, we are talking with the people handling our data usage agreement, and due to the fact that there are no proper regulation, the answer is just no. Whatever you ask is just no. You cannot release nothing of this. Instead, in Europe, in which you have more rules, in which you have more laws, is actually less of a gray area. We know when we can release stuff, and we know how can we train the model to release stuff, because the theory is there. Like, this model can be trained with what people call differential privacy, that there are techniques for doing it. But to then apply those techniques in the reality, you need regulation, and regulation are not yet there. I think there is not a common regulation scheme here yet.
Okay, well, I want to thank my co-chair, Amy Samoli, and all our panelists here and online for an outstanding start to the conference. And I want to thank you for spending your Sunday afternoon with us.